Imagine a man in his early 60s sitting alone at night, wondering about something he would probably never discuss with anyone. He has noticed that his sexual response isn't quite what it was 20 or 30 years ago. Maybe erections take longer. Maybe ejaculation feels different. And one question keeps returning. Is masturbation still healthy at my age? Or am I somehow draining my body? If you've ever wondered about that, you're certainly not alone. As men get older, sexual health can become confusing. One website says ejaculation may protect the prostate. Another claims masturbation lowers testosterone. Someone else warns that it causes weakness. But here's the problem. Many statements take a small piece of science and turn it into a conclusion. So today, we're going to slow things down and separate what we actually know from what sounds convincing. Getting older does not automatically mean losing sexual desire. Your body may respond differently, but sexuality can remain an important part of life well into your 60s, 70s, and beyond. And there's something else I want you to remember. This video is not going to give you a magic number and tell you how often you should masturbate. There is no universal schedule that every man over 50 needs to follow. Instead, we're going to ask a more useful question. What is your body telling you? Because sometimes the important issue isn't masturbation itself. It may be a change in erections, desire, ejaculation, medications, circulation, or overall health. And one surprising finding involves the prostate, but the real story is more complicated than the headlines. Before we talk about prostate health or testosterone, we need to understand something much more basic. What actually changes in a man's sexual system after 50? Aging does not simply switch your sexuality automatically off at all. Your body can continue to experience desire, arousal, erections, orgasm, and ejaculation. But the process may become slower, less predictable, and more dependent on the conditions. Think of it like an older car that still runs well, but may need more time to warm up. That doesn't mean the engine has stopped working. It means the system responds differently. Erections may take longer to develop and may require more stimulation. The recovery time after orgasm can also become longer. Doctors call this the refractory period. You may notice that ejaculation is less forceful or that there is less semen than before. Others may take longer to reach orgasm, while some notice reduced sexual desire. But desire and physical response are not the same. A man can still want intimacy while his body responds more slowly. On the other hand, interest may decrease because of stress, poor sleep, medications, or other health changes. Consider Robert, a fictional 62-year-old. He notices that he needs more stimulation than he did years ago. He immediately assumes his sexual health is failing and starts blaming masturbation. But that's not necessarily the right question. A better question is, what else has changed? Has his sleep changed? Is he taking a new medication? Is he under more stress? Has his blood pressure, blood sugar, or fitness changed? So if your sexual response has changed gradually, don't automatically assume something is wrong. But if a change is sudden, dramatic, painful, or persistent, it deserves a conversation with a healthcare professional. And now, an important question. If ejaculation changes with age, does ejaculating more or less actually matter for the prostate? Now that we know aging changes the response, not necessarily the ability, we can finally examine the claim that gets the most attention. Masturbation and prostate health. Ow. We come to the question that has probably caught your attention. Can ejaculation actually protect the prostate? A major study followed nearly 30,000 men in the health professionals follow-up study. Researchers compared reported ejaculation frequency with later prostate cancer risk. Ejaculations included intercourse, masturbation, and nocturnal emissions, so the study was not specifically testing masturbation. The researchers found something interesting. Men who reported 21 or more ejaculations per month had a lower observed risk of prostate cancer than men reporting 4 to 7 per month, especially for overall and localized prostate cancer. But here's what gets lost online. This was an observational study. Researchers observed patterns. They did not assign men to different schedules and prove that ejaculation prevented cancer. Imagine noticing that people who carry umbrellas are more likely to have wet sidewalks. You wouldn't conclude that umbrellas cause rain. The two things are connected, but one does not necessarily cause the other. Men who ejaculate more may differ in health, relationships, lifestyle, or other factors researchers cannot completely account for. Researchers still do not know exactly why higher ejaculation frequency might be associated with lower prostate cancer risk. One theory is that ejaculation may clear substances from the prostate, but that remains a hypothesis. More recent evidence is also nuanced. A 2025 systematic review and meta-analysis found that higher ejaculation frequency was associated with lower prostate cancer risk, while the specific relationship between masturbation frequency and prostate cancer was not statistically significant. The authors said more research is needed. So here's the myth. If you don't ejaculate regularly, your prostate becomes toxic. The fact is, there is no established medical rule saying every man must ejaculate a certain number of times to clean or protect his prostate. So don't turn research into a monthly quota for yourself. But prostate cancer isn't the only prostate issue men over 50 need to understand. Another condition can affect urination, ejaculation, and sexual function, and that connection may surprise you. That brings us to the difference between prostate cancer, an enlarged prostate, and ordinary age-related sexual changes. If you're over 50, there's a good chance you've heard the word prostate many times. But here's where confusion can begin. A larger prostate does not automatically mean cancer, and having prostate symptoms does not automatically mean something dangerous is happening. One of the most common age-related prostate conditions is called benign prostatic hyperplasia, or BPH. In simple terms, the prostate gradually becomes larger. This is different from prostate cancer. As the prostate grows, it can press against the tube that carries urine out of the bladder. That's why some men begin noticing a weaker urine stream, difficulty getting started, a stronger or more sudden urge to urinate, or the need to get up several times during the night. Some may also feel that their bladder hasn't completely emptied. Sexual function can change as well, although not every man experiences the same pattern. Now imagine a 65-year-old man who notices his urine stream isn't what it used to be. He remembers hearing that ejaculation cleans the prostate, so he decides the solution must be to masturbate more often. That sounds simple, but it misses the important question. Why has his urine flow changed? It could be related to an enlarged prostate, medications, bladder problems, or another condition that deserves proper evaluation. Masturbation cannot flush out prostate cancer. It cannot diagnose prostate disease. And ejaculation frequency should never be used as a substitute for appropriate medical care. This distinction is important because one habit may be completely normal while the symptom happening alongside it may be the thing that deserves attention. So if you notice a persistent change in urination, sexual function, pain, or other unusual symptoms, don't panic, but don't simply explain everything away as aging either. A healthcare professional can help determine what's actually happening. Later in this video, we'll go through several changes that should not be ignored, especially when they appear suddenly or persist over time. For now, remember this. Taking care of your prostate is much bigger than counting ejaculations. So if ejaculation isn't a prostate treatment, what about the hormone almost every man has heard about, testosterone? Now, let's talk about a hormone that seems to be connected to almost every conversation about aging in men. Testosterone. You may have heard a simple warning. Every time you ejaculate, you lose testosterone. And if you want to keep your testosterone high, you should avoid masturbation. It sounds scientific. But the human body doesn't work like a simple fuel tank. Think of testosterone more like a thermostat system. Your body is constantly producing, regulating, using, and adjusting hormones based on many signals. Ejaculation does not simply empty a tank that becomes permanently lower afterward. Testosterone naturally changes as men age, and levels can also vary for many other reasons, including sleep, body weight, illness, medications, stress, and overall health. There may be short-term hormonal fluctuations around sexual activity, but that's very different from saying that masturbation causes permanent testosterone depletion. And this distinction matters. If a 60-year-old man notices lower energy, reduced sexual desire, fewer spontaneous erections, or changes in mood, he shouldn't automatically blame masturbation or assume that avoiding ejaculation will restore his testosterone. Those symptoms can have many possible explanations. Poor sleep can leave you exhausted. Certain medications can affect sexual function. Depression and chronic stress can reduce desire, excess body fat, and some medical conditions can also influence hormone levels. That's why doctors don't diagnose low testosterone simply by asking how often someone masturbates. If symptoms suggest a possible hormone problem, a healthcare professional can evaluate the situation and, when appropriate, use properly timed blood tests to determine whether testosterone is actually low. So here's the myth. Every ejaculation drains testosterone. The better way to understand it is this. Sexual activity does not mean you're permanently losing your testosterone supply. And there's no evidence-based reason to tell every man over 50 that simply abstaining from masturbation will automatically raise his long-term testosterone to a healthier level. Your goal shouldn't be to fear ejaculation. Your goal should be to understand your health as a whole. But there is another question men often notice before they ever think about testosterone. Why does masturbation sometimes leave you feeling relaxed, calm, or even sleepy afterward? The answer takes us away from the hormone myths and into something much more immediate, the brain and nervous system. Have you ever noticed that after orgasm, your body seems to shift into a completely different state? Maybe your muscles feel relaxed. Your mind becomes quieter. You feel satisfied, calm, or even ready to fall asleep. If that happens to you, you're not imagining it. Sexual arousal involves the brain, nerves, hormones, blood flow, and muscles working together. As arousal builds, your nervous system becomes highly engaged. Then, following orgasm, the body begins moving toward a more relaxed state. For some people, that change is very noticeable. Imagine a 67-year-old man who says, "I always feel relaxed afterward, so masturbation must be healing my body." There's an important distinction here. The feeling of relaxation can be completely real without proving that masturbation is treating a disease. Feeling calmer doesn't automatically mean your blood pressure is being treated. Feeling sleepy doesn't mean insomnia has been cured. And feeling good afterward doesn't prove that you're preventing prostate cancer or heart disease. This is where many online health claims go too far. Sexual activity can be associated with temporary feelings of relaxation, satisfaction, and well-being. But those experiences are different from evidence showing that masturbation can prevent or treat a specific medical condition. And everyone's response can be different. One man may feel sleepy, another may simply feel relaxed. Someone else may notice almost no change at all. Your emotional state matters too. Stress, lack of sleep, relationship circumstances, expectations, and even how comfortable you feel can influence the experience. That's why there's no reason to worry if your response isn't identical to someone else's. And there's another important point for men over 50. Don't judge your overall health by how you feel immediately afterward. The bigger picture matters much more. Are your erections changing? Has your sexual desire suddenly dropped? Are you experiencing pain? Have your medications changed? Are you sleeping poorly or dealing with a new health problem? Those questions can tell us far more than whether you feel sleepy after orgasm. So yes, relaxation afterward can be a normal part of the body's response, but feeling good is not the same as treating disease. And this distinction becomes especially important when we talk about erections, because sexual activity and erectile health are related, but they're not the same thing. For many men over 50, one of the biggest concerns isn't masturbation itself, it's what happens during an erection. Maybe you notice that erections aren't as firm as they once were. Maybe they take longer to develop, disappear more quickly, or don't happen as often. And naturally, you may wonder, is masturbation causing this? Usually, that's not the best place to start. Masturbation shouldn't be viewed as a guaranteed treatment for erectile problems, but neither should it automatically be blamed for them. Erectile function depends on several systems working together, including blood vessels, nerves, hormones, medications, emotions, and the brain. Think of an erection like a team effort. Blood needs to flow properly, nerves need to send the right signals, and the brain needs to participate in the process. If one part of that system changes, erections can change too. Occasional difficulty is common, especially as men get older, but persistent erectile dysfunction deserves attention. Why? Because erectile problems can sometimes be associated with conditions such as high blood pressure, diabetes, cardiovascular disease, obesity, smoking, medication effects, stress, or poor sleep. That doesn't mean an erection problem automatically means you have heart disease. It means your sexual health can sometimes provide clues about your broader health. Masturbation may simply make you more aware of those changes. For example, imagine a man who has always had a reliable sexual response. Then, over several months, he notices a significant change. Instead of asking, "Am I masturbating too much?" a more useful question would be, "What else has changed in my health? Has his blood pressure increased? Has he gained weight? Is he sleeping poorly? Did he start a new medication? Has his stress level changed?" The frequency of masturbation may be much less important than the change in sexual function itself. And remember, getting older can affect erections without meaning something is seriously wrong. But a sudden or persistent change shouldn't simply be dismissed as, "I'm getting old." Your body may be giving you useful information, and sometimes the answer isn't your age at all. It may be sitting in your medicine cabinet. Let's look at one of the most overlooked reasons sexual function changes after 50. Medications and everyday health conditions. Sometimes what looks like a sexual problem is actually a medication problem, or a sleep problem, or a circulation problem. This is especially important after 50 because sexual function doesn't operate in isolation. Your brain, blood vessels, nerves, hormones, medications, emotions, and general health all influence what happens sexually. For example, some medications used to manage blood pressure can affect sexual function in certain people. Some antidepressants can affect sexual desire, arousal, orgasm, or ejaculation. Other commonly prescribed medicines may also contribute to sexual changes. That doesn't mean you should stop taking a medication because you've noticed a change. In fact, please don't stop a prescribed medication on your own. Instead, tell your healthcare professional what you're experiencing. Sometimes the timing of a symptom provides an important clue, and your clinician may be able to determine whether the medication could be contributing or whether another explanation makes more sense. Now consider sleep. If you're regularly sleeping poorly, waking repeatedly during the night, or feeling exhausted throughout the day, your energy and sexual desire may suffer too, and chronic stress can make things even more complicated. When your mind is constantly focused on bills, family responsibilities, work, or health concerns, it can become harder for your body to respond sexually. Then there are physical conditions. Diabetes and vascular disease can affect blood vessels and circulation. Excess body weight can influence metabolic and hormonal health. Depression can reduce sexual interest. Chronic pain or mobility problems can make intimacy physically difficult. Alcohol can also interfere with erections and sexual performance, particularly when drinking is excessive. Imagine a man who suddenly notices that his sexual desire has dropped. He assumes he's getting too old, or perhaps he blames masturbation. But then he remembers that the change began shortly after starting a new medication. That's a completely different conversation. The important lesson is not to jump to conclusions. Your sexual response can sometimes act like a dashboard light. It doesn't tell you exactly what the problem is, but it may tell you that something deserves a closer look. And that's empowering, because many of these factors can be addressed. So instead of asking only, "How often am I masturbating?" consider the bigger picture. How am I sleeping? What medications am I taking? How is my blood pressure, blood sugar, weight, stress, and overall health? But there's another side of this conversation we haven't addressed yet. When does masturbation itself become something worth changing? So far, we've talked about what masturbation does not automatically cause. But there's another question worth asking. When could it actually become a problem? The answer may surprise you. It's usually not about a specific number of times per week. There is no universal frequency that every man over 50 should follow. Some men masturbate rarely. Some do it more often. Others don't masturbate at all. None of those patterns, by themselves, automatically tell us whether something is healthy or unhealthy. A better question is this: what effect is the behavior having on your life? Think about it this way. If something is becoming difficult to control, repeatedly interfering with your responsibilities, disrupting your sleep, creating physical irritation or injury, or causing significant distress, that's more important than simply counting how many times it happens. For example, suppose a man regularly stays awake late because he feels unable to stop, and the resulting lack of sleep affects his energy and daily responsibilities. That's worth paying attention to. Or perhaps masturbation has begun replacing intimacy he genuinely wants with a partner, creating tension in the relationship. Those situations are different from simply having a certain frequency. Another important point is control. If someone feels that a behavior has become compulsive, meaning he repeatedly tries to change it but cannot, and it's interfering with his life, talking with a healthcare professional or qualified mental health professional may be helpful. But there's something else we need to be careful about: shame. Feeling embarrassed about masturbation does not automatically mean you have a medical disorder. Sometimes the distress comes from beliefs, cultural messages, or fear rather than from the behavior itself. So here's the myth. If you masturbate more than a certain number of times each week, you have a problem. The fact is, there is no universal age-based number that defines a disorder. Your body isn't keeping a scoreboard. Instead of asking, "Am I doing this too many times?" ask, "Is this affecting my sleep, health, relationships, responsibilities, or sense of control?" That question gives you much more useful information. And if everything is functioning normally and the behavior isn't causing problems, there's no reason to create anxiety, simply by counting. Now let's turn to the myths that can quietly create unnecessary anxiety because some of the most repeated claims online simply don't survive a closer look. Let quote S clear up 5 myths that can create unnecessary fear and confusion. First, masturbation causes permanent weakness. Not according to the evidence. You might feel relaxed, sleepy, or temporarily less energetic afterward, but that's very different from permanently losing strength. Your body is not being drained of some essential supply every time you orgasm. Second, masturbation permanently lowers testosterone. Again, that's an oversimplification. Testosterone naturally fluctuates, and many factors influence it. Ejaculation should not be thought of as permanently emptying your testosterone reserves. If you're experiencing symptoms of low testosterone, that's something to discuss with a healthcare professional rather than assuming masturbation is responsible. Third, you must ejaculate a specific number of times to protect your prostate. This is where online headlines can become misleading. Research has found associations between higher ejaculation frequency and lower prostate cancer risk, but those studies do not establish a magic monthly target or prove that masturbation itself prevents cancer. So don't turn an interesting research finding into a prescription. Fourth, if you're over 60, masturbation is unhealthy or inappropriate. Age does not automatically erase sexuality. Sexual desire, intimacy, and sexual activity can remain meaningful parts of life as people grow older. What changes from person to person is the experience, not some imaginary age cutoff. And finally, the 5th myth, masturbation can replace a prostate check. Absolutely not. No sexual habit can diagnose prostate cancer, rule out an enlarged prostate, or replace appropriate medical evaluation. If you have persistent urinary symptoms, pain, blood in your urine or semen, or significant changes in sexual function, those symptoms deserve proper attention. And here's why these myths matter. They can make men worry about completely normal experiences while distracting them from changes that actually deserve medical attention. So instead of asking, "Am I masturbating too much?" ask a better question. Has something about my health or sexual function changed? That's where the conversation becomes much more useful. And the last mistake is actually more important than all 5 myths combined. Ignoring a change in your body simply because you assume it must be aging. So what should you actually do with everything we've discussed? The answer isn't to obsess over masturbation. It's to build the kind of overall health that supports your body, your circulation, your energy, and your sexual function. Start with your cardiovascular health, regular physical activity, healthy blood pressure, managing cholesterol, and avoiding smoking can all support better circulation. And good circulation matters for sexual function because erections depend on healthy blood vessels. Next, pay attention to your weight and metabolic health. Carrying excess body fat can be associated with problems that affect hormones, blood vessels, and overall energy. You don't need perfection. Even sustainable improvements can matter. Then look at sleep. If you're consistently sleeping poorly, don't simply accept exhaustion as part of getting older. Persistent sleep problems deserve attention because poor sleep can affect mood, energy, and sexual desire. Your medications deserve a review too. If you notice a significant sexual change after starting or changing a medication, tell your healthcare professional. Don't stop prescribed medicine on your own. Ask whether there could be a connection, and don't underestimate stress. Walking, spending time with people you care about, relaxing, enjoying hobbies, and creating time away from constant pressure can support your overall well-being. There's also something many men overlook. Intimacy is bigger than ejaculation. Affection, communication, closeness, companionship, and a healthy relationship can all be important parts of sexual well-being as you age. And finally, think of masturbation as a personal behavior, not a medical prescription. You don't need to chase a magic number, and you don't need to fear every sexual response. Healthy aging is much bigger than one behavior. Your heart, sleep, mental well-being, medications, relationships, activity level, and overall health all matter. The goal isn't to become obsessed with sexual performance. The goal is to understand your body, notice meaningful changes, and give yourself the best foundation for healthy aging. If you remember only a few things from this entire conversation, make them these. If you've stayed with me this far, let's bring everything together. Because after all the myths, research, and questions, there are really 5 things I want you to remember. First, sexuality does not automatically end after 50. Desire, intimacy, erections, and orgasm can all remain meaningful parts of life as you get older. Your response may change, but changing does not automatically mean something is wrong. Second, masturbation is not inherently harmful simply because you're older. There is no reason to assume that being 60 or 70 suddenly makes a normal sexual behavior dangerous. Third, there is no medically established universal ejaculation target. You don't need to hit a certain number every week or month to prove that you're protecting your health. Your body isn't keeping score. Fourth, research has found an association between higher ejaculation frequency and lower observed prostate cancer risk. But that's not the same as proving that masturbation prevents prostate cancer. The research is interesting, but it should not become a prescription or a reason to ignore established medical care. And fifth, pay attention when something changes. A sudden or persistent change in your erections, sexual desire, ejaculation, urination, or comfort deserves attention rather than embarrassment. It doesn't automatically mean something serious is wrong. It simply means there's a reason to understand what's happening. So, what is the truth about masturbation after 50? It's much less about finding a magic number and much more about understanding your body, recognizing meaningful changes, and taking care of your overall health. You don't need fear, you don't need shame, and you don't need to believe every dramatic claim you see online. You need good information, reasonable self-awareness, and medical guidance when something doesn't seem right. And perhaps the most important lesson has nothing to do with masturbation at all.